are now moving into the strategic plan conversation. This was supposed to be a fireside chat, actually, that Kelly and I were going to do at the AGM, but we'll do a virtual one. And so I'm going to make a few comments initially, and then I'm going to turn it over to Kelly. So this process was exhaustive. It took us a full year to complete. We took the time we needed to think through where we were and where we are with cystic fibrosis in Canada and about Cystic Fibrosis Canada. We thought about the strengths and the opportunities for the organization, as well as some of the weaknesses and some of the threats that we thought we might be facing. Obviously, we didn't anticipate the big threat we're in now, but others that were under consideration. So we consulted and we pressure tested our ideas and theories with a broad group of stakeholders. Undoubtedly, some of you who are on the call today were involved as well. So through the work of the committees and consultations with stakeholders, we were able to develop and refine these strategic priorities that will guide our work over the next few years. And so this plan was approved by our board last December. So I'm seeing slide 3. I don't know if that's the one, but anyway, so I'm going to just continue. In building our strategic plan, we took stock of the world in which we currently operate, so that we had the context to position CF Canada, Cystic Fibrosis Canada, most effectively. And some of the contextual pieces that we needed to consider.
Mitch?
Yep.
You're stealing my thunder, so maybe we'll go back. And I'm not sure what notes you're on.
Okay.
So maybe you'll just pass the baton to me.
Okay, I'm actually on this other page here. I'm not sure what happened there. I was on the wrong page.
That's okay. Cut. Operation. Start again.
Cut. I'm gonna actually slide down through to about halfway through. So looking over back of the life of our previous strategic plan, there were many accomplishments that we wanted to address, and some that we are very proud of having met. So we're very proud to have launched the country's first CF clinical trials network. We're in the process of rolling out a new program to transition supporting transition of care from the pediatric to the adult clinics. We were able to secure newborn screening in all provinces. Our renowned Cystic Fibrosis Canada registry now has a patient portal component attached to it, where people can access and better manage their own health information. The CFIT research program is revolutionizing the way we look at personalized medicine for people living with cystic fibrosis. And importantly, we have continued to lead the way in terms of life expectancy for people living with cystic fibrosis, with a predicted median age of survival for children born with CF in Canada today, or in 2018, of more than 52 years. So as we look forward, we are unquestionably in an exciting era, but we also recognize that there's still a lot of work to be done. People with CF, yes, are living longer, but they are still living lives that are much too challenging and in some cases much too short. So with that, I am going to pass it over to Kelly to elaborate on the strategic plan.
Thanks, Mitch. I know there's more people joining us on the presentation from the AGM, and I want to thank you for your leadership as chair of the board and as a key member of the strategic plan committee. It's been an absolute pleasure working with you, and I thank you for all you've done for Cystic Fibrosis Canada. I'm so pleased to be sharing our strategic plan with you all today. One thing before I get started is you may have questions as I'm presenting, and I'd encourage you to use the chat function. When you put it in, you'll submit to all panelists. If you do it wrong, it's okay, we can see it. And nonetheless, in the chat, put your question in the chat window, and we'll try our best to get to as many questions as possible. And if we aren't able to get them all, we'll address them in a Q&A on our website so that you get the answers you need. So as Mitch said, clearly the way we're presenting our plan today to you today was not the way we planned to roll out our new strategy. Rather, we were scheduled to be together with many of you at our Volunteer Leadership Forum in Toronto, where we planned a so-called fireside chat style presentation to unveil our new strategic plan. So here we are today in a virtual Zoom meeting, and perhaps you can all envision a roaring fire and a couple of chairs as I share our plans for Cystic Fibrosis Canada over the next number of years. Today, I especially think back to the founding of Cystic Fibrosis Canada, as this year marks the 60th anniversary of our organization. Doug and Donna Summerhays are with us online, and I would be remiss if I didn't recognize them and the many other volunteers who gave them themselves to start our organization so many years ago. So I'll start with a tip of a hat to our founders and all the volunteers past and present who have brought us to where we are today. This is National Volunteer Week, and we acknowledge this and offer our heartfelt thanks to all of you for your support and tireless efforts. We have embarked on a new era in cystic fibrosis. People are living longer with the disease, and there is great promise for continued progress towards longer and healthier lives. However, as Mitch said earlier, despite remarkable progress, Canadians with CF are still living lives that are too short and too challenging. The excitement around the introduction of highly effective modulator therapies has been dampened by the fact that most Canadians do not have access to them. Furthermore, while these modulator drugs hold great promise for the majority of people with CF, many people in our community already have advanced disease and will require specialized care for their complex health needs, while others with rare mutations may not stand to benefit from these advancements at all. Slide 2, Devin. In early 2019, Cystic Fibrosis Canada embarked on a strategic planning process to set our organizational priorities for the next 3 years. This process was led by board members and staff and included consultation with people living with CF, their families, researchers, clinicians, donors, partners, and members of the global CF community, as well as key opinion leaders in the charitable sector. The process was exhaustive and took us the full year to complete. We took time to think through where we are with cystic fibrosis in Canada and about Cystic Fibrosis Canada itself. We thought about the strengths and opportunities for the organization, as well as the weaknesses and threats. We consulted and pressure tested our ideas and theories with a broad group of stakeholders. Undoubtedly, some of you are here who are here with us today. Through the work of committees and consultation with stakeholders, we were able to develop and refine the strategic priorities that will guide our work over the next few years. And this plan, as Mitch said, was approved by our board last December. Slide 3. In building our strategic plan, we took stock of the world in which we operate so that we would have the context to position Cystic Fibrosis Canada most effectively. Some of the contextual pieces reviewed included the significant advancement in treatment, but also the fact that these treatments are not a cure, and that even for people who take the highly effective modulator therapies, the disease will likely continue to progress in ways that remain largely unpredictable, which means that most individuals with CF will still require access to medicine and specialized clinical care. We also recognize that these therapies are not relevant for all people living with CF, and that there are still people for whom there are no treatments. We also recognize that for many people living with CF, their quality of life is significantly impacted by the burden of their care. We acknowledge that we now have an aging CF population, which brings different issues and new health challenges for our community. Within the research sphere, we noted that globally, there is now more money available for CF research than ever before, most notably in the United States through the Cystic Fibrosis Foundation. The theme of health system cost containment, both in the federal and provincial governments, was also noted as an important contextual piece, both in clinical care and because our new drugs are not deemed to be low cost. In addition, we recognize that there have been important innovations in healthcare, as we have seen explosions in digital health, the use of artificial intelligence, personalized medicine, and interest in patient choice through the health landscape. And finally, we noted the charitable landscape and the fact that most Canadian health charities are coping with little or no revenue growth. Slide 4. Before I get into the plan, I'd like to share some of the defining qualities or the principles of the plan. So first of all, there is a sharp focus in all areas. It's like I often said, we gave it a bit of a haircut and really narrowed things in. And we have clarity on what we want to achieve in all areas. The theme of less is more really resonated throughout this plan. Our work will be directed, as it has been before, by the needs of our community. We've declared a strong interest in and a necessity for partnerships, whether that be for our programs, for our operations, and in particular for our funding. We declared we don't have to lead everything, and we can work in partnership with others to make the change we want to see. So we have better clarity on where we will lead, partner, or follow. We're committed to innovation, whether it be in our own work or in advancing the health outcomes of people living with CF. And we've thought about where we fit into the world CF ecosystem based on the strengths of our organization. So now I'd like to take you through the plan. All of our efforts are focused on improving the health and well-being of all people living with CF. Specifically, the impact we are driving to over the next 10 years is improved health outcomes and quality of life for all people living with CF in Canada. Now turning to our strategic priorities. Now I want to note that these are not written in order of importance. All are important and all have our focus. But as you know, you have to put something first. So here we go. The first priority is to improve access to life-changing and life-sustaining medicines. And what will we do in this area? We will advocate for health system change so that our drugs have a fighting chance. We will also produce a report on the burden of CF so that we can make the case for this needed health system change. And we will expand our clinical trials network, which is another way to get drugs to people and to ensure continued R&D and innovation in CF drug development. We will primarily lead this work, but we will also work in partnership with others, including the CF community and other related organizations. The impact of this effort will be, there will be more people in Canada with CF who have access to symptom management drugs and modulators. Our second priority is to improve the quality of care and the treatment experience for people living with CF. And what will we do in this area? We will drive the development and implementation of Canadian standards of care. Despite the fact we have amazing care in Canada, Canadian standards don't exist. We will also develop and test funding models so that our funding helps to ensure we see the implementation of these standards across Canada. And thirdly, we will fund innovation in CF care in areas that will decrease the burden of care experienced by people living with CF. We're going to facilitate this work in partnership with the CF community, people living with the disease, and clinicians. And what will be the impact? We will have Canadian CF standards for care that are both developed and used, and there will be innovations that reduce the burden of care faced by people living with CF. This work is a little different than how we've been working in this healthcare space. We declared that we wanted to use our funding and our role as a knowledge broker to ensure we can create quality-based care, which we have, but through standards, and innovative care across Canada. Our third priority is to advance research on priority health needs. And what will we do here? We're going to fund research that is, one, focused on the priority health needs of people who have the poorest health prospects. And two, this research will have an impact on their lives in the short term. And what does this mean in lay terms? Because as hard as we try to write it in lay terms, I'm not sure we get it each time. But it means that we're going to be focusing our research program so that it is focused on the priority health needs of people for whom modulators will come too late to make a significant impact on their health, and on the priority health needs for those with rarer mutations for whom there are no modulators. Our research program will also be focused on projects that have an impact in the short term. We want change for this community I've just spoken about now. This work will be developed in partnership, of course, with the CF community and researchers, but what is different is we're going to be seeking funding partners so that we can enhance the investment put forward by CF Canada. Over the next 3 years, the impact of these efforts will be evidenced because we'll see more investment in priority health needs, priority health areas that have an impact on people's lives in the short term. Our fourth priority is to leverage digital strategies and peer connections. CF Canada has long been a trusted source of information for people living with CF in Canada. However, the information needs for people with CF and their families have been shifting in the digital world of today, and we need to ensure that we're meeting these needs. And what will we do? Number one, we're going to ensure we understand the priority information needs of people living in our community by implementing ongoing mechanisms to get input. We're going to, two, test and deliver digital strategies to ensure our community has access to credible, relevant information. And three, we're going to work with the community to build and test new ways of facilitating peer connections so that people with CF and their families can better connect and support one another. We're going to lead this work, but we will seek partners to support us on our delivery. The impact of this work will be timely and relevant information provided to the CF community by both CF Canada and by their peers. The last and very important priority visually is at the bottom as a structural piece, almost holding up a house. And it's focused on strengthening our organization for impact. In order to achieve the impacts we so desire for our community, we have to continue to strengthen our organization in two key areas. One, people, our staff and volunteers, and two, revenue. And what will we do in this area? In the area of people, we're going to foster a culture of excellence and develop a team of high performers. We're going to focus on our volunteer program, ensuring we're meeting the current needs of volunteers, but also ensuring we're positioning the organization for future volunteer growth. With respect to revenue, we're going to enhance our fundraising program through a focus on diversification, operational efficiency, and expanding a culture of philanthropy across the organization. And the result of this work will be engaged, high-performing collaborative staff teams, a mutually rewarding volunteer program, and sustained and growing revenue. Slide 5, Devin. And this is our plan. The strategic plan is an important framework. It provides us with an outline on where we believe we should be focused and the impact we want to see. I think an important thing to remember about strategic plans is that they are a dynamic document. No organization or strategy can be static. We need to remain nimble and adjust where needed. And we've seen this in our work to advocate for access to treatments, as well now with the current pandemic. With the impact of COVID-19, we may find ourselves needing more time to achieve some of our work or seeing new opportunities to fast track some of our work. For instance, there's a lot of work happening now in innovation in care, which without the pandemic might have been much slower to put in place. We've also had to adapt quickly and shift resources to provide much needed information and support to our community during the COVID-19 pandemic. We're currently working in close partnership with our CF clinicians who are referring patients and families to us to meet their information and support needs. And we've responded with a host of new resources that have been developed in a very short period of time. Some of this may form the basis of how we think about delivery of information and support in the post-COVID-19 world. really what a plan does is it gives us a good direction on where we want to focus and what we want to see differently. And we found this plan already guiding us and directing our efforts as we navigate this difficult period of time. And with that, I'm going to close so I can leave some time for questions if there's any. Okay, I'm going to turn it to Jeff, Jeff Beach, who's going to moderate any questions. Jeff, you may need to unmute. And sorry, folks. Devin, can you switch to Jeff?
There we are, I think.
Yep, we hear you.
There we are. Okay. We're all learning this new technology as we go along here. So as Kelly mentioned, we did want to set aside a few minutes for questions that have come in this afternoon. And please feel free to submit any questions that you may have, either now through the chat or as you think about things, as you digest this information, feel free to submit them through to myself or Kelly or any members of the management team, and we'll get back to you. And based on questions coming in, we'll most likely be developing some further Q&As and so forth. So one of the questions that we wanted to ask today was, that was put forward today rather, was what would you say, Kelly, are the biggest differences between this new strategy and CF Canada's previous 5-year strategic plan?
So as you can see from the plan, we're still in similar functional areas that we've always been in. So we still are in research and healthcare, advocacy, and information and support. So those are key functional areas that I think everyone knows about when they think of CF Canada. I think the main difference really has been that we've given it more of a focus and really clearly pushed for what the impact is that we want to see differently. And we've really narrowed in. I sometimes talk about a restaurant that has many items on its menu. We've really been deliberate about having fewer items on our menu in each area so that we can drive to particular impact for our community.
Thanks, Kelly.
And if I could jump in there.
Sure.
With this more refined focus that is presented in this strategic plan, that will have impact on many of the decisions that we make going forward. Our last 5-year strategic plan was a comprehensive plan. It was very, very ambitious with a very large number of to-dos, if you will. What this one will do is it will help us to be more specific in the decisions we make, whether it's what we finance, our finances, our allocation of the funds that we collect, and this plan is also more aligned with and reflects, as Kelly mentioned earlier, the reality of cystic fibrosis research and development in the world today. So I think that's another area that differentiates it from the previous one.
And I should have said, it is definitely different in our research. Our research is much more, as Mitch just alluded to, our research is very, very focused on the health priorities of our community who have the poorest health prospects, and on the short term, and that's the difference in terms of our research investment.
Thank you, Kelly and Mitch. Another question that's come in. Can you tell us more? You mentioned in the plan that there's going to be a focus on near-term gains in research and how this will affect the research that CF Canada is funding in the future. So can you maybe explain a little more about what is meant by near-term gains in research and how that might differ from the research that we have traditionally funded?
Yeah, so I think we're going to elaborate more on this on a Q&A online so people can see, because we want to get, we're not going to have the time to flip to John right now, John Wallenberg. But really what we're trying to get at here is there's lots of amazing research that we've invested in and have others in cystic fibrosis that got us to where we are today. things that take a long time to work on, and to find the foundation for the disease, finding the gene, then finding the how to treat cystic fibrosis. Those are investments that take a long time. There's people now who want to see change in our community, and we heard them in our strat plan, that want to see change sooner than later. We're going to try our best to invest in those areas that are sooner than later without putting a time frame on that, because John needs to go out and our team and meet with the scientists to better understand what kind of projects that could look like and what kind of time frame we're looking at. But we definitely want to see, and Jeff was on our committee, we had struggled with this language of as nearer term or shorter term, but not looking at things that we're not going to see change for 30 plus years. We want to find a niche for ourselves that's in the shorter term investments.
Thanks, Kelly. We had a question that's come in. One of the people who's joined us today is Ron Smale, who's with the Robbie International Soccer Tournament Committee. Hi, Ron. Ron asks, what mechanisms or processes can be created and executed to assist volunteers at the ground level of fundraising more directly in an effort to generate more revenues and awareness of CF? So really, to summarize, I think it's an important part of our plan to mobilize our volunteers, and that's certainly an important piece of our fundraising strategy. That has always been an important piece of our fundraising strategy, but we're looking to enhance the work that we do with volunteers and make sure that groups like the Robbie on the ground are able to continue to and push forward in terms of fundraising for us going forward. Kelly, Mitch, do you have anything you might add to that?
Well, volunteers are a key part of this plan. We haven't been anywhere without our volunteers, and we won't be anywhere going forward without our volunteers. What we want to do is better understand we want to better engage with our volunteers to understand what their needs and priorities are, and to learn from them, so that we can come forward with a better engaged volunteer community, if that's even possible, but thinking forward. In terms of the mechanisms or processes that can be created to assist you guys at the ground, as Jeff said, that's also part both in our last strategic priority number 5, in terms of how we're going to work with volunteers, but also in our fundraising priority to look at diversification and how are we best using the resources we already have, which one of them is our volunteers, and giving them the right tools so that you can fundraise even better than you have. I mean, I will say, Ron, we are an amazing organization in terms of what we raise through volunteers on the ground level compared to many other organizations. But we really want to tap into learning from you in terms of what your needs are and to other organizations so that we can enhance this. And I think Mitch wants to say something on this front too, Jeff.
Yeah, and this is a really important question, and it's foundational to our organization. And I've had some conversations at for some of you will recall the conversations that I've had at some of the regional meetings about this. So we have been looking at the whole notion of chapters and how it relates to volunteerism and volunteer management and that kind of thing for it's been on our minds certainly for a number of years. Haven't completely wrapped our heads around it. But I think as an organization, we have to look very deliberately at what does volunteerism and who are volunteers in our organization. Traditionally, they've been members of chapters. I continue to be involved with the Durham chapter. But increasingly, we're finding that, and I think many of you are finding that, for example, when you're organizing local events, you have people who align themselves maybe to a particular event. You'll see them come out for that one particular event every year faithfully, and then you won't see them for the rest of the year. So in terms of who are our volunteers and what do we need to do to better engage, certainly with chapters and at the chapter level, but outside, because really our volunteer network is much larger than chapters. I just have to be quite honest about that. The other part to this is, what is the nature of volunteer work in our organization? Our volunteer network raises a significant portion of our revenue. It's something in the neighborhood of like 2/3 of the revenue. But over the past year, we've seen other forms of volunteerism that have been very, very important in the life of Cystic Fibrosis Canada and in the life of people living with cystic fibrosis. And one example that I frequently give is in the whole area of advocacy. We have seen incredible volunteers at the grassroots level, say grassroots, I would say outside of our organization, and you know, in families at that level, who have been very, very effective in volunteering their time, their experience, telling their stories, speaking at events, and certainly advocating with the government, writing briefs, and all those kinds of things. So as an organization, we really have to wrap our heads around volunteerism. What is it? And how, as an organization, can we support the activities of volunteers that go above and beyond fundraising? Absolutely, absolutely critical fundraising and revenue generation. But there are some other activities that if we don't get involved with it, I think we're gonna miss an opportunity to support some people out there and to partner with people. So it's a big, big question, and I'm really glad we've addressed it in our strategic priorities.
Those are all really great points. Thank you, Mitch and Kelly. And I would just add that it's through the work of groups like the Robbie and like Kin Canada and many others partners that we have, in the case of the Robbie and Kin Canada, have had as partners for almost the entire history of our organization, that we've not only been able to generate some really significant funds to help advance our mission, but also created a groundswell of support. So we have a much bigger reach than we would as a CF community through the work of those groups and those volunteers. And that's a really important point that we want to continue to build and stress as we launch forward in this new strategy. I understand that Agatha has a question, and Devin, you're going to switch over to her, perhaps?
Hi there. Sorry about that. It was just because I don't actually, sorry. Anyway, thank you so much. So the first thing I want to say is thank you. This strategic plan, can everyone hear me?
Yep.
Yeah, okay. This strategic plan is fantastic. Okay, I'm just saying that because it reflects so much of our nation. Like, that is wow. Sorry, but thank you so much. So my tiny little question was, I know it was a crew out of BC, and it was a 2 psychologists that were working on like a national. Did we ever have a conclusion on that study? Because it was like, for me, it seems like there was 2 studies in the last 4 or 5 years that CF Canada has chosen, and I'm not disagreeing, but to stop the studies. So one was like a ground-based research here in Nova Scotia that after 1 year, nothing ever happened. And this other one I thought was a study maybe funded by CF Canada, and I think it was the psychologist out of BC. Sorry if I'm...
It's okay. No. So Agatha, are you... I think you could be referring to the mental health work happening at
It was
BC.
absolutely that. Yeah.
So I'm hoping John
Psychologist.
Wallenberg, I think he's online. And I'm wondering, John, if you could unmute yourself and maybe you could respond to the status of that work. I'm just going to see if this works to everyone. And
Okay.
Like, it was just they
There
were
he
working
is.
for 8 to 10
Yep, he's
months.
there. I hear him.
And people hear me. So
Yep.
there are a couple of things. I'm not 100% sure what you're alluding to, Agatha. There was a survey that we promoted by a couple of psychologists out west, but they work out of Regina.
Yeah, it was them.
and
Sorry, you're right.
And they were looking into, if I recall differently, the sort of the different impacts in the different ways that people deal with cystic fibrosis. Those studies take a certain amount of time to accumulate and to analyze the data, and then to get published. To my knowledge, those studies have not been published, but that doesn't mean that the work isn't going on in the background to analyze the data. What I can say is that through that group, we became aware of an online mental health program that is also run out of Regina, and that targets people living with chronic diseases, including cystic fibrosis. And what this group does is this group, this isn't research any longer. So this group, they provide CBT, so cognitive behavioral therapy, over the internet, so online, for people who are in order to be able to manage anxiety and depression. So
this is phenomenal.
And this is a resource that we've recently, I believe, made available or made the link available on our website. So that is something that is currently available to that. The other study you were talking about out east, I'm not too sure.
It was Mary McDonald. It was just that it was a 1 year only, and it was, I think her name was Mary. It was from the university here in Halifax, or Dartmouth. I don't know. And it was a ground-based research, like from the ground up or something. And it was a 1 year only, but then I think it was either inconclusive. I don't know. I just never heard the ending. And we were hours and hours and hours of time that we gave our whole life in the private room.
Agatha, John, I'm just going to circle back. So Agatha, I would, what I think we'll do is we'll take your question offline, but I want to circle back to where it fits in the thanks, John. I want to circle back to where it fits in the strategic plan. So one of the areas I talked about in number 2, strategic priority number 2, was about quality of care and reducing the burden of care. And what we're trying to get at there, or innovations to reduce the burden of care. And one of the priorities that we hear from our community is about what Agatha talked about, which was about mental health. And so we're going to confirm that's a priority to our community, which sounds probably ridiculous to lots of you because we already know it is, but we want to make sure we're really being informed. And let's say mental health isn't one of our number 1 priorities, then that's something we would work with the clinics and other clinicians to look at. So what could we do differently to promote mental health? Maybe it's like this program John spoke about. What else? Like, could people share best practices or practices that they're using in different clinics? Can we fund certain programs, certain people? So we're not only looking at what's the best care, but we're also looking at what is the experience of people living with cystic fibrosis, and how do we make that experience better through our funding or our facilitation through knowledge broker, or connecting people together. Or a national call line, as Agatha said. So we're looking at that, like being informed, and then seeing what's, as John said, seeing what else is out there, which is how we'd work in partnership or leverage other resources that are out there. So we don't have to recreate the wheel or reinvent the wheel, but just, I never get my sayings right, reinvent the wheel, but use what's already available to support our community. Jeff?
Thank you. So I think we have a few minutes left, and there are a couple of more questions that have come in. One of them was from Doug Summerhays, who I know, because he texted me during the AGM, had some trouble getting into WebEx. So Doug, first of all, I just want to acknowledge that your presence was noted by Mitch and Kelly during the AGM, and as was your upcoming 90th birthday. So congratulations from all of us to you on that. So Doug's question was related to whether we would be producing other materials on the strategic plan, some written materials and so forth. And the answer is yes. We are trying to minimize what we actually produce in print, but we will have printable and shareable resources, summaries of the strategic plan that will be available and posted, some narrative pieces to go along with that, and some video component to it as well. So there will be lots of different formats available in terms of how we communicate and share our strategy as we roll it out. Also, there's a question that I understand, Devin, has come in from Allison. Is that correct?
You can, I think you're unmuting, Allison.
Allison, are you with us? Okay, we don't hear Allison, and I don't have any other questions that have been submitted at this point. So at this point then, I will thank you and turn it back over to Kelly and Mitch.
And Allison, if you are online and we just couldn't get to you, just send me an email and we're happy to answer any questions. To all of you, if you are sitting with it and having questions later, we, all of us would appreciate hearing from you. And we put a lot of blood, blood, sweat, and tears into this, so we hope it hits the mark, and would be happy to answer any more questions or hear your comments. So I want to thank everyone for joining us today. We appreciate your interest and the support of our new strategy and the passion that you all bring to the table. You're the reason that we pull this together, and you inspire us every day. So thank you so much. And with that, we'll end this this presentation on our strat plan. Thank you.
Thank you, everyone. For the board members, I'm going to remind you we have a board meeting, and I think we should probably try and start that. It's 3:22. We should try and start that at 3:30, please. So please log into the WebEx for that. Thank you. Thanks, everyone.
Agatha, just email Shannon.